This video is about the rules of medication administration, and this is something that you're going to hear a lot about in fundamentals and throughout your nursing career. I'm just including it in here because it might show up on one of your math tests, even though it's not really technically math. So these rules are put in place for safety. You've been given some abbreviations and you need to know them. There's also this sheet of error-prone abbreviations. You can just get that off the internet. So we've changed some of the abbreviations because people were getting them mixed up with other things. So that's something to be aware of. And before administering any medication, of course, you're going to stop and you're going to start these 10 rights of medication administration. So first of all, you want to have the right patient, and you can see from this list that there's several patients that have a pretty close name. You know, John White spelled differently, Joe White, and then John Smith. You know, and then the medications, you know, are pretty close too. Cozar and Zocor, very close in name. So you really want to make sure that you have the right patient. And some patients can start to look alike. You know, these three guys kind of look alike. So you really need to be looking at something to tell whether you have the right patient. One of the things that you do is you're going to check for patients' identifiers. You're going to check the bracelet. You're going to use two patient identifiers, and it should have their birth date, their date of birth, and they can state their name. And you want to compare the medication order to the identification bracelet, and verify also allergies with the chart and with the patient. Very important to check out those allergies. So then you want to have the right medication, and again, this is the same list that you saw earlier. So you can see that some of the medications are very close in the name of them and even in what they do. So just make sure that you have the right medication. And to assure that you have the right medication, what we do is we perform a triple check. So when you get the medication off the shelf, you're going to look at the name of it, or when you get it out of the Pyxis, you're going to look at the name of the medication. And then when you're preparing it, say if it's a pill and it's in a bubble pack, when you're popping it out of the bubble pack, you're again going to look at the name of the medication. And then you're going to check the doctor's orders, and then you're going to never administer medications that somebody else prepared. That would not be a good thing. And also the third part of the triple check is before administering the medication to the patient. So when retrieving it, when preparing it, and before administering it, and never administer medication that is not labeled. You will be labeling medications that you prepare, so that between where you're preparing it and the patient, you know exactly which medication is the one that you want to give. The right dose, you want to check the label for medication concentration. It's very important. Compare prepared dose with medication order. Sometimes the pharmacy will prepare it, and you want to make sure that the dosage is right. Double check all medication calculations, which you should be pretty good at. Check all high-risk or pediatric medications, like for instance insulin, heparin, some of those. Verify that the dosage is within the appropriate dose range, and this is important for children especially, but even for an adult. You want to make sure that the dosage is, you will learn, and you'll have in your mind the common medications that you give a lot. You'll know the dosage range for those, but other medications where you don't know, you need to just check on that. Check in a medication book. Okay, so the right time, you want to verify the schedule of the medication. You want to give it at the right time, the right date, and they have a rule that you can give like the medication an hour before or an hour after, or sometimes at some facilities it's a half an hour before or a half an hour after the exact time that you're supposed to give it. If you don't give it within the right time, then it's not then it's a medication error basically, and you don't want to do that. You want to make sure that the right dose, and you're just going to do that again by checking the medication when you pull it off the shelf, when you're preparing it, and before you give it to the patient. You want to look at that dosage, just make sure. The right patient education. So here we have you want to tell the patient what you're giving them if they're aware of anything. You want to let them know this is your blood pressure medication, this is the one for your heart. Remember, you take it at home, you've taken it for years, you know the effects of this medication, that kind of thing. Or say, for instance, if you're giving a pain medication, I have your pain medication here, and this is morphine. Have you ever had a bad reaction to morphine? That sort of thing. So you want to inform the patient of the desired effects. You want to say this is for your whatever, and side effects as well. And also, again, if you haven't asked for allergies before, you're going to ask for allergies here to this particular medication. The right to refuse, the patient doesn't have to take the medication. They don't want to. So you just need to let somebody know if they're refusing to take the medication. We ran into this over there at in fundamentals on the Alzheimer's unit, where because it was a new nurse, well, it was a student nurse, the patient did not want to take the medication because they didn't know that person. So you just want to let the responsible party, the nurse or your instructor, know that the patient is refusing the medication. Or if you are already a nurse, you would of course tell a doctor, and make sure that the person understands. This is your blood pressure medication. If you don't take it, it's very possible that your blood pressure will go really high, and you know how that feels. You don't like it when you get really high blood pressure, so you might want to go ahead and take this. You want to just talk to them, and then of course you have to document that the refusal happened. You need to do the right assessment. So, like say for instance with pain medication, where is your pain? How bad is it? What helps it? Does cold or hot help the pain or make it worse or whatever? So you want to do the right assessment. If it's some medications you have to check their pulse before you give it, or some medications you have to take their blood pressure before you give it, that sort of thing. So if the right assessment tells you that you should not be giving that medication, then you don't give that medication, and you document the reason that the medication dose was skipped. Okay, so then you've given the medication. So now after the medication has been administered, you want to do the right evaluation. This is important because a lot of times it's missed. You give pain medication to a patient, and then you never go back to say, is it helping your pain? And so you never document that, it's helping them. And this is something that we've struggled with in nursing for a while. So you just want to make sure that you do that you go ahead and do that evaluation after the medication has been administered. And you want to document that it has helped or not. So you want to do the right documentation. So you never want to document before the medication is administered. And I know that this is kind of controversial. Some nurses, and you're going to see it, they do that anyway. They're going to document, but don't you do it, okay? And so anyway, you want to sign that SN for student nurse, and if your instructor needs to sign, co-sign with you, then you need to get that co-signature. So that's it for medication administration, and like I said, you will be hearing a lot of this in fundamentals, but here you just have like a really short rendition of it.